Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have Dr. Joseph Rosado. He is a respected medical authority on cannabis as plant-based medicine. He has written several articles for medical journals as well as 7 books, including the best-selling Hope and Healing, the Case for Cannabis. Welcome to the show, Dr. Joseph.
Thank you very much. It's my pleasure to be here. Thank you for the invitation.
You are welcome. Welcome to the show. Welcome to India in this online form, Dr. Joseph. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll talk about medical cannabis as well as alternative therapies. All this we'll talk. But before that, Dr. Joseph, let us understand a bit about you, your background, your journey, so that people know who they are listening to.
Well, I went the long route in my journey to become a physician. I'll explain that. At the ripe young age of 16 in 1978, I became a certified nurse's aide or orderly. I worked 2 years in the hospital setting until I became 18. Once I turned 18, I became an emergency medical technician working on ambulances. Then I became a paramedic on ambulances as well. Then I became a heart cath lab technician, assisting cardiologists performing heart cath lab studies of the heart, looking for blockages, opening up the blockages, treating people with heart disease, whether it was blockages or if there was an electrical problem or things like that. From there, I suffered and sustained a very severe auto accident that caused me to have a fracture in my spine. And because of that, I was so impressed with the chiropractor that took care of me, I went on to chiropractic school. I became a chiropractor, practiced 5 years as a chiropractor, became frustrated with the limited scope of practice, and at that time, I entered medical school. So as you can see, medical school was my sixth career. Upon graduating medical school, and at that time, I was married and I had 1.5-year-old twin daughters who are now 28 years old. So that tells you how long I've been doing this. And now I have 4 grandchildren thanks to those 2 beautiful daughters. Following medical school, I went on and got an MBA, Master's in Business Administration, in Healthcare Management, because I knew how to be an excellent doctor with all those years of medical experience, but I had no understanding of the business concept of medicine. And in the United States, that is a big part of being a successful provider, a successful businessman, and a successful physician. And so I continued on. Within medicine, I branched into different areas and arenas. From primary care medicine, pain management, hormone replacement therapy for men and women. And then from 2015, 2016 on, I've dedicated my practice and my life pretty much solely to the use of medical cannabis for multiple conditions, ailments, diseases, and helping people have a better quality of life without depending and utilizing controlled substances, medications, that many times have greater side effects and more problems than the actual diseases that they are dealing with or suffering with.
Right, right, Dr. Joseph. So from a proper, traditional medicine, the modern medicine, to plant-based medicine, cannabis. Why this shift? Means you lost hope on the modern medicine, or you only lost hope on one aspect of the modern medicine? I want to understand this part. Or there is a, if there is any disclaimer you want to say, because are you representing any sort of a organization or any sort of a benefit that you may have or in talking about it, so that the audience knows about who they are listening to?
Sure. The only organization that I represent is International Medical Consultants, which I am the president, founder, and CEO, where I consult other countries, whether they be government officials, physicians, or lay people on the use and management of medical cannabis with their patients. I've traveled to Fiji, Thailand, Malaysia, Mexico, Colombia, Costa Rica, Argentina, speaking all over the United States, Canada, speaking on the benefits of medical cannabis. And You asked me why I chose medical cannabis. I am an atypical physician in that I learned a little bit about the endocannabinoid system in medical school. Now, what does the endocannabinoid system mean? What is that? We've all heard of the respiratory system, the cardiovascular system, the gastrointestinal system, but very few physicians, in fact, less than 10% of medical schools in the United States, and I would venture to say worldwide, teach on the endocannabinoid system. The endocannabinoid system is the system that all vertebrates have. All humans, all animals that have a spinal cord have an endocannabinoid system. What does that mean? That we all produce cannabis. We all have receptors in our body where those cannabinoids that we produce work upon. As we age or as we have dis-ease or lack of ease, we then those levels are depleted. We have to supplement those receptors to maintain what we call in medicine homeostasis or balance. And for us to maintain and obtain that balance, we utilize cannabis exogenously. I believe that in India, in Ayurvedic medicine, cannabis is a big component of traditional or medicine as compared to conventional medicine. Is that accurate?
Yeah, people know about it, but you cannot go and having cannabis just at your will. Means I'm not exactly sure about the legal aspects of it, but it is not generally considered to be. Yes, maybe physicians must be allowing it at the local level. I have to find out, but yes, we know about this. People know about this. People talk about it, and a lot many times it is talked about for pleasure purposes where people use it. Okay, and that is where which brings me to my next question: is how does a layman understand whether one is talking about cannabis for pleasure or normal cannabis versus medical cannabis? Is there a bifurcation here, or is it the same thing? Just when you use it differently, it becomes medical.
That is an excellent question. And the only difference between medical cannabis in the United States and adult use or recreational cannabis is the fact that for you to obtain a medical cannabis card, you must see a medical doctor or a doctor of osteopathy in the state of Florida. Other states allow a broader range of providers. Other countries allow for a broader range of providers. But in my state, where I practice in Florida, only medical doctors and or doctors of osteopathy are allowed to recommend medical marijuana. And in the state of Florida, we have qualifying conditions, conditions that are named that qualify an individual. Uh, these include, but are not limited to, post traumatic stress disorder, HIV, AIDS, cancer, epilepsy, chronic seizures, um, Crohn's disease, multiple sclerosis, Lou Gehrig's disease or ALS. But we have a little caveat, and that caveat also Parkinson's disease. But we have a caveat, and that is any chronically debilitating condition that is equal to or greater in severity than the ones mentioned also would qualify. So someone that has anxiety or depression or insomnia would qualify under the PTSD or post-traumatic stress disorder umbrella. For people with chronic pain or nerve pain because of diabetes or some medication that they've taken, whether it be chemotherapy or HIV/AIDS medication that causes nerve pain, we can put those people under multiple sclerosis. And so you can see that we as physicians have the ability to shift patients around. My office is a clinic of inclusion, not exclusion. We want to make sure that everybody gets this alternative care with minimal side effects. When I learned about the endocannabinoid system in medical school, I learned also that cannabis does not cause physiological dependence or addiction. It causes psychological dependence, meaning if I were to stop using cannabis, I will not go into what is called withdrawals. My body will not yearn or crave for the marijuana or the cannabis. It does, you can take a break, a pause, and not go through that, contrary to narcotics, opiates, cocaine, alcohol, etc. And so, as a layperson, it is important that they understand that what you're using when you're using cannabis, whether adult use, recreational, or under medical, you're still working on those same receptors. And the majority of the people that medicate without the recommendation of a physician, they are doing so, they are self-medicating. They know that they have problems with anxiety. They know that they have problems with focusing. They know they have problems sleeping. And so they know, based on trial and error using black market cannabis or marijuana, they know what to purchase in a dispensary based on years of experience. For those patients that I see, many are pediatric patients, children with intractable seizures that have 200 to 300 seizures a day, or the elderly that have just been diagnosed with a stage 3 or 4 cancer of the lung or of the prostate, or have Parkinson's disease. They are not going to feel comfortable going to an adult use dispensary. They're going to obviously come to see a physician that knows what medications they have, knows what diseases they have, and is able to direct them to the proper um, plans, the proper tools, the proper components to be able to address the different symptoms and avoid any adverse reactions or any drug-drug interactions.
Right, right. So I want to understand. So is the medical science, the modern medical science, giving way to things like this? For example, say our system knows what cannabis is, and perhaps if we put that into the system, it will help. It's like for diabetes, they say that insulin production has gone down, so you can go to other ways of doing things. Then in terms of in terms of other things, for sunlight, you go under the sunlight because you got vitamin D, and this whole industry is now shifting towards a whole lot of functional medicine. People talk about functional foods, people talk about, does it look like that there is a whole alternative medicine industry coming in, or is it the extension of the modern medicine itself? How do you look at it from both sides? You have seen it from very close.
The truth is that what we call alternative medicine was medicine when it began. Cannabis was discovered in Asia 5,000 years before Christ. Uh, and it started in your region of the world. And so that's what medicine was. We were utilizing plants and food to treat our diseases and our ailments. We weren't using medicines. We weren't using capsules. The majority of the medicines come from natural sources. There's a medication that's used to treat patients with heart disease called digitalis. It comes from a plant. Aspirin comes from white willow bark, so it comes from a plant. Um, Opiates, narcotics, comes from poppy seeds, which is where opium is produced. So it all comes from the plants. We have just, through modern science, have converted those things that were in plants and put them in a pill form. There is a synthetic version of cannabis called marinol or dronabinol or sesamet. Um, these are synthetic versions of THC. The structure is found in the plant. They just have learned to replicate it in a laboratory.
Right, right, Dr. Joseph. So I want to understand. You talk about India. You talk about use of cannabis in since long in the way our life has been in medicinal purpose. People used to use for recreational purpose. We also have this whole system of homeopathy. Why
Mhm.
doesn't people like you talk about homeopathy? Then why about this plant medicine called cannabis? Talk about homeopathy. It has no side effect. It is considered, many people have started now believing that this really works, and if there is an option, people can do more research on that. Why not homeopathy? Why only put bring cannabis out of this, out of Asia?
Well, I brought that to get today because that was the topic of the show. I could speak on homeopathy. I'm just not a homeopathic doctor. I've had no training in homeopathy. I've used homeopathic products for generalized issues like gastrointestinal problems. For years, I suffered with ulcers, and combining the cannabis with the homeopathic remedies with conventional medicine, it it's there's more than one way to skin a cat. There's more tools, and all cannabis has become for me is another tool in my toolbox to be able to provide the best care to patients. Does everybody benefit from cannabis? No, but not everybody benefits from an aspirin either. If I give an aspirin to five different people, one person it'll work for, one person it will do nothing for, one person it will make them sick to their stomach, one person they will have an allergic reaction and cause them to itch and break out in hives, and one person it can kill them. One medicine can cause those five things. So imagine if I don't have other tools to be able to manage and treat the thousands of patients that I've managed not only in Florida but around the world.
Right. So even plant-based medicine can have contraindications, if I understand that medical term.
Exactly. We have to be knowledgeable of what the patient, what their conditions are or is, what medications they are presently on, and then what we're going to do to address so that we restore balance and restore their health.
Right. Now let's understand the medical use of cannabis. Where do you want to use cannabis where the present treatment options are available but are not working? Or you think cannabis will work better and present treatments are not known to work better? How does that? Because a lot of new terms have come up. Hemp, psychotropic substances, and everyone is going towards mental health, mental issues,
Mhm.
and everybody wants to treat that immediately with whatever is possible, not in modern science but outside of it. Help us understand this part about cannabis, the how much cannabis can treat whatever it can treat.
Sure, perfect. I'm glad you bring up mental health, mental illness, because that there is a huge epidemic worldwide, particularly following the pandemic. People being locked up in their homes. We are social beings. We like to be surrounded by people, and being isolated for that length of time caused a lot of anxiety, depression, people that lost their jobs, lost their livelihood, affected their income, people that lost their loved ones due to the disease, caused a severe escalation and elevation of mental health conditions all over the world. I am the medical director of a mental health clinic in Northeast Florida, one of the oldest cities in the United States, called St. Augustine. And we manage and treat people with a lot of mental health issues and conditions. The challenge with many mental health medications is that it can take anywhere between 2 to 6 weeks before they feel the effect of those medications, because they have so many chemical imbalances going on in their brains, in their adrenal glands, different organs, different parts of their body, that it takes a while for them to feel those effects. With cannabis, we have what are called phytocannabinoids. Phyto means plant, cannabinoids mean that work on the cannabinoid receptors. And so you have different components. You have CBD, you have THC. Hemp, as you mentioned, is very rich in CBD, does not cause any euphoria. All of them are psychoactive because they all work on the brain. And so they work on receptors in the brain. So they are all truly psychoactive. The proper difference is that some cause euphoria or the sense of highness, and others do not. And so you have THC, which does cause euphoria. You have CBN, which also causes euphoria. You have THCV, which helps with weight loss and weight management. You have CBG, which is the mother phytocannabinoid, where all other phytocannabinoids come from. And that is 5 times more powerful as an anti-inflammatory and antioxidant than CBD. THC is 20 times more powerful than aspirin as an anti-inflammatory, and twice as powerful as cortisone as an anti-inflammatory. So you can see that there are many components that work on pain, inflammation, uh, as well as uh, just general overall well-being. You also have what are called terpenes, which are the substances that give the smell and taste to the plant, that also have medicinal value. So linalool, which gives the plant a purple coloring or purple hue, is found in lavender. Limonene is found in citrus. Beta caryophyllene is found in pepper. And so you have these that are found in nature also have components that help heal. And so combining that, we have what is called an entourage effect, which is an effect that works kind of like an orchestra. You go to the symphony, you've got the percussion section, the brass section, the woodwind section, the strings, and together they make amazing music. Every once in a while, you hear a solo, but after a moment, they all come in and work together. Same thing with the cannabis plant. It's a symphony of different players that at times you may need one more than another based on the situation or the condition that you have. But at the end of the day, it's the entire plant that does the work, together with counseling, support systems, and sometimes conventional medicine, because conventional medicine is phenomenal in the acute phase. When something is going on right now, if I, God forbid, am involved in an automobile accident and I break a bone, I'm going to need an orthopedist to do surgery, put a cast, and take care of me. But as far as the chronic condition, that's where I'm going to go and rely on natural substances rather than substances that can cause greater harm.
Right, right, Dr. Joseph. Now, some places, very few places have actually allowed the use of marijuana or whatever the name they want to put, or cannabis or hemp, whatever it is. Why is it that only very few places have allowed it? Even within the US, you would know it better, other countries. Why is it that others have not allowed it? What are their apprehensions? What are their reservations about this? Though Western society is quite modern, they have a lot of understanding about these issues. What does the research, why does the research into the use of cannabis not convince them so strongly as much you sound in your discussion?
Because there's a very famous book that in there they say it is written that people perish for lack of knowledge, and government and politicians and religions have downplayed the benefits and effects of this plant. They forget that it is a plant, and regardless of your belief of creation versus uh, uh, any other philosophy, you have to understand that it is a plant and it's been in existence longer than we have been in existence. And so, as a result of that, we have been sold a bill of goods on falsehoods. Now, understand that in these United States of America, there is a federal patent for the use of cannabis for chronically debilitating conditions, specifically neurological conditions. But yet, they have demonized it because back in the 30s, 40s, 50s, there were individuals that were against the concept of using cannabis because they felt that if a white woman was smoking marijuana with a black man, they would possibly engage in sexual activity. And this country at that time was not in a place to accept that. And so they demonized it and they created a film that was promoted and uh, promulgated all over elementary schools, middle schools, and high schools called Reefer Madness, where they talked about the ills and demons associated with the using of cannabis. And so it came from a negative propaganda, and pretty much whatever is thought and believed in this country tends to migrate all over the world and causes belief systems that are not accurate.
Right, right. There is much to understand, and I'm sure a lot of people can get a lot of their answers from your book, Hope and Healing, the Case for Cannabis. How have you made the case for cannabis in your book? Is it much more different than what you have talked about? What
I
any side effects that you have talked about in your book?
Sure. In my book, I go into more detail, more depth. You know, our conversation today is going to be 25, maybe 30 minutes long. The book compiles uh, histories and stories of patients that I've managed and treated up until 2019. A new version is going to be coming out here shortly, but beyond that first book, I have published 6 other books that are all disease specific. One book is on multiple sclerosis in cannabis, another one, chronic pain in cannabis, the third one, epilepsy in cannabis, the fourth one, cancer in cannabis, and the last one, mental behavioral health, anxiety, depression, post-traumatic stress disorder, and cannabis. But in the original book, the first half of the book goes into some history, goes into the modes of administration, how to use it, whether you smoke it, whether you inhale it, whether you use a gel capsule, you use a suppository, use a topical cream or a patch. I discuss all of that. I talk about the different phytocannabinoids and their medical benefits. I talk about the terpenes. And then in the second part of the book, it is a chapter and a disease. So Parkinson's and cannabis, post-traumatic stress disorder in cannabis, epilepsy in cannabis, etc. So as far as side effects or adverse effects, with cannabis, thus far, nothing has shown that anyone has died from using cannabis. However, you can have or experience what is called greening out. What that means is if you use a product that is too high or too rich in a euphoric substance called THC, then you can experience what is called tachycardia. Your heart rate begins to speed up, your mouth becomes dry, you can become paranoid, you can hallucinate, you start to see things that aren't really there, you start to sweat, perspire, and people become very alarmed and they feel as though they're on the verge of dying. And all they need to do is either use some CBD to offset that, suck on a lemon because lemon contains limonene, a terpene that blocks it, or 3 grains of black pepper because that has beta caryophyllene that also blocks the adverse reaction of the THC. But unfortunately, in this country, we have a 911 system where they dial 911, emergency medical services arrive. My former self gets to the house, either the EMT or the paramedic. They show up, they start laughing at the person, they take him to the emergency department, and then the emergency room physician, who I also was once in my past life, will discuss cannabis use disorder. And now they've labeled this person as having cannabis use disorder when all they did was ate an entire edible and felt that after 30 minutes they felt nothing. And so they ate a second one. And then 2 hours later, when it was finally metabolized in the body, they experienced an overstimulation of all their senses and all those receptors.
Right. There is so much to learn. One thing I want to understand, what is your understanding of the use of cannabis? Should it be limited to only medical use, medicinal use, or people will then take recourse to, if it is allowed, then they will take you to recourse to recreational purposes. So should there be a very strong law only for medicinal use, or is it a way people want to get into this market by talking of medicine and then looking, it's no, it will open that big door for them.
Okay, so that is an excellent question because presently, as we speak, next Tuesday on November 5th, in this state of Florida, we will be voting whether we will allow for adult use, aka recreational use in the state of Florida. Presently, we only have a medical cannabis program, and next Tuesday, we, the 22 million citizens of the state of Florida, are going to vote to allow or disallow adult use. And this is the answer I give everybody. As a businessman, I am in favor of adult use because if one person of the tourists that come to the state of Florida to enjoy our beaches and enjoy our sunshine and enjoy our amusement parks, and only 1% of those people purchase cannabis and pay the sales tax that is going to be involved, as a businessman, I see that as a huge benefit to our state, our infrastructure, our economy. Definitely. As a physician, I'm going to defer and go to the medical cannabis side of things because there are certain individuals that need to be seen by a physician because their medical conditions are so complex and so challenging that if they don't have a proper physician that knows how to mix and match and combine cannabis with their conventional medicines, it can be detrimental to the patient.
Right. Very balanced view here, Dr. Joseph. But be that as it may, there is much for the common man to understand about these things. At least from this part of the world, I am trying to understand that part of the world better and all those issues related. But let the great men, wise men, guide us, and we will keep looking at how this whole discourse pans out. But there is, so as I said, there are so many people who'd like to learn more about it, more about you, about all these things. So what's the best way for them to connect with you?
They can go to my website, which is josephrosadomd.com. That is josephrosadomd.com. And on there, you'll have all the links to my social media channels and platforms, as well as you can send me an email by way of that. You can schedule a 15-minute free consultation with me to see if this treatment is of benefit to you. I'm also available for additional conversations, so we could do a 2.0 of this conversation on your channel, or you can put me in touch with some influential politicians, political leaders, decision makers in India, and I would be more than happy to travel to your beautiful country and educate the masses on the use of this plant. I have a passport. I am willing to travel, and my favorite food is Indian food. So all you have to do is feed me.
Absolutely, absolutely. We are great hosts. We are great. We're known for his hospitality here. A guest is considered as God, but obviously that will not include, I guess, cannabis here, but only the talk of cannabis, perhaps.
We can only
Be
talk
that
about the cannabis, but eventually
yes,
we will change the rules and regulations and change the laws. And maybe I could be a pioneer in your country, just like I have been a pioneer in others.
wonderful, wonderful. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.
My pleasure. Thank you.